Susanna, for putting together wonderful slides. I had the awesome opportunity to meet a few of the members of the Berkeley chapter at a networking event just last month. And they invited me to join you all and share a little bit about my career path, which I'm really happy to do. I was an undergrad not too long ago, and at that time we didn't have an organization like this, so it makes me really happy to see that there's so much interest in health fields in our community, and also that there's kind of efforts like this to support and uplift and share resources with each other. So thanks again, and I hope this is at least somewhat helpful to you all. Feel free to throw questions in the chat at any time. If I use any abbreviations or words that aren't clear, honestly, just feel free to unmute or ask me to clarify. And I guess before we jump right in, I just wanted to frame this by saying that what I'll share is my own personal experiences, because that's what I can speak to. But I think it's really important to acknowledge that career paths are really never kind of a straight line, and no two paths are going to be exactly the same. So for better or worse, a lot of times there's no like right answer, and that what's right for each person is going to be different. And I also want to say just explicitly that my own experience is in medicine. And I know and I love that we have folks in our group here who are interested in other health fields, dentistry or nursing or public health or other things. And I'll try to be kind of as broad and general as possible, but obviously we'll have a lean toward kind of what I've seen in medicine. Okay, I guess with all that, we can talk a little bit about how I got here and what I learned along the way. Thank you. So I am originally from here in the Bay Area. I was born in Montreal in Canada, but we moved to the Bay Area to Santa Clara, which is just 1 hour south of San Francisco, when I was in 3rd grade. So I spent the majority of elementary school, middle school, high school, all here in the Bay Area. And then I did undergrad also here in the Bay Area at Stanford. Don't worry, I have a lot of friends at Berkeley too. And during my time at Stanford, I was a biology major. And I decided pretty early on that I wanted to try to apply to medical school. I've tried to think about this many times, and I can't remember kind of the first time that I became interested in medicine. I think when I was little, I had a lot of people in my life who were in the sciences and specifically in healthcare. My mom is a pediatrician. She's been working in pediatrics clinic, so taking care of patients outside of the hospital my whole life, and she loves her job more than anyone I know. So not sure when I first got the idea, but I was always kind of interested in the sciences, loved physics, chemistry, biology, and then during undergrad with my biology major, did a lot of kind of the same pre-med classes. For me, the bio major made sense because there was a lot of overlap with the classes I already wanted to take for to be pre-med. And then I didn't have to do a lot of other requirements and did have room to take other things that were randomly interesting to me, like computer science class or French grammar class or like a sleep and dreams class or history of the Middle East. So for me, that was a really good fit. And during undergrad, I am happy to talk about this later if there's like more questions about this piece, because I feel like probably those years are the most relevant to this group. But I did some research early on. So the summer between high school and actually starting undergrad, I did a project that was like a bench basic science research at Stanford. And then during one of the summers of undergrad, I did some clinical research, and that was with a cardiologist that I met through some of our pre-med association events. And that was some basic kind of like literature searching, doing some chart reviews and things like that. So not like super intense, and only really over those summer months that I had a gap. And then during one of the other summers of undergrad, I actually did an internship program in Armenia through the Armenian General Benevolent Union. EGBU has a summer internship program in Yerevan that's been ongoing for many, many years. And honestly, it was like one of the most formative experiences of my life, which I'm happy to talk about if there's questions about it. But through that program, I did a public health internship at the American University of Armenia in Yerevan. So I was like one of the other summers. And then I guess in the last summer between junior and senior years when I was applying to medical school. And so I applied directly during undergrad, which is very uncommon. At that time, this was like 11 years ago. I feel very old. It was more common for people to go straight through without necessarily taking gap years, but people were starting to take more gap years. And then now I can say, having reviewed applications, both for residency and medical school, it's very, very common to take gap years, either before, in the middle of, or after undergrad, kind of before transitioning to medical school. But I applied directly. I did the MCAT kind of during that year, during, I guess, my third year, and then did the applications during the summer, fall. And then happy to talk more about kind of what the application process was like. But at that point, I applied pretty broadly to medical schools on the East Coast, West Coast, even in Canada. I actually interviewed at a Canadian medical school in Montreal, which is where I was born, and my cousins are, and that's where my parents both went to graduate school. Actually loved it there. Love my interview day, love the program, love that I would be close to family. I was very close to going there. And then I got into UCLA pretty late in the medical school kind of application cycle. And then once I did, I decided that I wanted to go there, both because like I actually really liked the school and the feel of the interview day, and because I really wanted an opportunity to stay in California and to be in LA. So that was part of the reason that I applied there. And I guess just reflecting back, I was trying to think about lessons for these like different steps along the way in application process. And for undergrad, for me, maybe unlike you all, didn't have that many friends who are also pre-med. Most of my friends were engineers or math majors or physics majors or things like that. So I wasn't surrounded by that many people who were going through the same thing that I was. And the entire application process felt very kind of unfamiliar to me and a little bit like a black box. I didn't really know what I was getting into. And anytime I Google searched anything or read forums, it just all sounded very scary and unclear. And so I think what I learned from that experience was that it's like very okay to ask for help in those situations and to look for resources that you may already have available to you. So I would say things like this group, things like your mentorship opportunities like through your universities, career counselors, and people who go through this all the time with tons of students like you know this really well. It's their job. And so they can, if you have an opportunity to go over your application, to meet early with the different career counselors, guidance counselors at your institution, I would definitely recommend doing that, just because it's a stressful enough process as it is. You don't need to make it any more stressful for yourself by trying to go through it alone or to like navigate it in darkness. So that's probably what I learned with that step. And then for medical school at UCLA, I know most of the folks in this group are not in medical school yet, so I'll go over this very briefly, but happy to answer questions later. The med school there was structured in kind of like 2 years of preclinical years and then 2 clinical years. And so the preclinical years are not too super different from undergrad in the sense that a lot of it is still kind of lecture style. So like lectures, classrooms, like small groups, some labs, like anatomy labs and things like that. But most of the time you're studying, taking tests, spending time with like fellow students. And then during the 3rd and 4th year, we're all clinical rotations. And so that transition from the like classroom to being at the bedside with patients is a really sharp transition where suddenly the focus is not necessarily teaching you all the time, and you're kind of teaching yourself, and the primary priority is, hi, current 4th year med student. The primary priority is the care of the patients who you and the team are seeing. And so I think that is always kind of like a tough transition point. And at the same time, it's like an opportunity to finally see kind of everything that you've been learning and everything you've been thinking about in actual practice. And so I really loved my med school time. And some of my closest friends are from those 4 years. And I'll say that the clinical years for me, especially the 3rd year of med school, which anyone here who's been through 3rd year of med school may know, was really tough. And I say that not to like scare anyone, but just to normalize that these are challenging times, and that it's okay to like be open and tell people about when you're having a hard time. And for me, I think the hardest thing was going from a situation where I felt very comfortable kind of learning and and teaching and being surrounded by my classmates to a situation where I felt like I was always kind of performing on my rotations and being judged and not in lots of unfamiliar situations, not really sure what my role was or what I was supposed to do. And so that was like really hard for me. And what was important for me at that time and what I like took away from those couple years was that how important it is to surround yourself with people who can really like support and uplift you during those hard times. And so I lived in a house with 4 other medical students who are all like some of my closest friends now, and their support was so helpful for me in my like mental health during that period. And after that, actually during that 3rd year is when I did my internal medicine rotation. And I'd always known, I think, throughout med school that I didn't really want to do anything that was very procedure heavy, like surgery or OB/GYN or things like that, where most of your day is doing things with your hands. I liked thinking a lot more. And I was leaning more toward doing something that was general and not like super specialized, since I wasn't extremely passionate about just like skin or just eyes or just any of those one things. And so I kind of thought that I would like internal medicine. And then when I did my internal medicine rotation, which was at UCLA, it was like 2 of the best months of my life. I really loved working with all of the attending doctors who were the supervising doctors who were with us. A lot of them were hospitalists, which is what my job is now. And they just were incredible teachers, just incredibly kind and passionate about what they did, and took the time to really explain to me kind of how they think about the patients that they're taking care of, and all the parts of their job that go beyond kind of what we had learned in the classroom. So love those, and then decided that I want to apply for internal medicine residency. And the application process for residency is not too different than medical school. It's during your last year of medical school, and it's pretty standardized. So you're sending kind of like the same application to all the different programs, choosing which ones you want to apply to. And then after the initial kind of like written application period, there's the interview period. And then the difference is that it's a matching process at the end. Sorry, that's my cat. And for internal medicine, at least when I was applying, it wasn't like a hugely competitive specialty, at least compared to some of the other specialties that my friends were applying to. And so for that step, I decided to apply a little bit more narrowly. So mostly around like the West Coast programs. And so interviewed in Southern California, Northern California, a few places. And then ended up matching at UCLA, which was very unexpected for me, and that match day was still like one of my happiest days, since I really didn't think that was going to happen, and was super excited to get to stay and work with some of my closest friends and like close mentors and people like that. So I stayed for residency, and I'll be like more and more brief as we go. Residency for internal medicine was 3 years. It's all clinical work, sometime in the hospital, sometime outside of the hospital. And during most of residency, I was just deciding between doing critical care, which is like being an ICU doctor, versus doing hospital medicine, which is what I do now, which is doing general internal medicine, not specializing any further, and taking care of patients in the hospital. And I went back and forth on those a bunch of times. And I think during residency, I really loved my time in the ICU, and the ICU doctors I worked with really encouraged me to do critical care. And I felt a little bit like I should do that because it was like the harder thing to do, and maybe the cooler thing to do, and the more exciting thing to do. And it wasn't until my very last year in residency, like toward the end, that I realized that just because like I can do it doesn't mean that I necessarily should. And I realized that, during my time when I was in the ICU, I had a really hard time kind of like with all of the bad outcomes and a lot of the deaths and things, and had a hard time separating myself from that, and would just find myself being like really down and sad, as opposed to my time on my hospitalist services or hospital medicine services, where I really just found a lot of joy from the day-to-day work. So for that reason, decided to not apply to fellowship, which would have been necessary if I did critical care. And then after my 3 years of internal medicine residency, I did 1 year as a chief resident. And this is different in every program. So every specialty has a different way of approaching this. And even like programs, internal medicine programs at different places have different meanings for being a chief resident. For our program, it meant doing an extra year where you do some clinical work, where you get to be like an attending on the services inside the hospital, working with residents, but only for like 2 months of the year. And for the rest of the time, you're doing a lot of administrative work, a lot of teaching of students and residents, a lot of like feedback with the residents, kind of the link between the residents and the leadership in the program, a lot of support and coaching and things like that. And so I did that for a year, and it was great. I learned a ton, which I still use every day. And I'll say that for me, it was really valuable because it was the first time that it wasn't completely like a gap year, depending on what you call a gap year, but it was for me like the first time that I took kind of a break of a year in my training. And it was wonderful. And I guess the lesson that I would take away from that is that breaks are good. And no matter when, it'll be a different time for each person of when it makes sense to take a break and what that break looks like. And if that break is within medicine or is in their degree, or is completely time off doing something unrelated, but whatever it is, some time to like have to reflect and to really think about your next steps and take a little breather is really, really good. So it was definitely a hard year in certain ways, but just having weekends off to myself and having like more of an 8 to 5 job on weekdays was really, really nice for a year. And then during that chief resident year is when I started applying to jobs, and I applied within California. Actually, I decided that I wanted to come back to the Bay Area because that's where my family is. And I've always felt like a Bay Area person. So I applied to hospitalist jobs up here in the Bay Area. And I started working at UCSF in 2019, summer of 2019. And I've been here since then. And then I can maybe transition to just talking about what this job is like, which is the next slide, I think. Yeah, so I think, and I won't spend too much time on this because I know not everyone here is interested in internal medicine, but just as an example of kind of how many and how different jobs can be within the field of medicine and within the field of healthcare. So hospital medicine is, or being a hospitalist, is a specialty that has only been around for a couple of decades. And it literally means what it sounds like, which is that you work in the hospital, taking care of hospitalized medicine patients. And specifically, I take care of adult patients, so not children, anyone over the age of 18. And people who are in the hospital for non-surgical kind of issues or non-specialty issues. So some examples would be, someone coming in with a lung infection or pneumonia, or more frequently, someone coming in with a fever and you think they have an infection, but you're not sure where, and you need to do some tests to figure out the infection in their kidneys, or is it in their abdomen, or is it in their lungs, or where is it? Or someone coming in with shortness of breath and low oxygen levels, and you're not sure, is it because of their lungs? Is it because of their heart? Is it something completely unrelated? Is it because their blood levels are low? And so that's the kind of patient who would come to hospital medicine, or like a medicine service, and can be taken care of by a hospitalist. And so what I love about it is that every patient I take care of is a little bit different. So on a given day, if I have 10 patients that I'm seeing, every one of them will have a different set of problems, both different set of active problems and a different set of like chronic problems, and different life circumstances, different backgrounds, different stories. And so I really like that variability. It's definitely not a field for everyone. So if folks like kind of being really, really good at one thing and specializing in that one thing, this is like not the field for you. If people don't like acuity, like taking care of really sick patients, making real-time decisions and seeing things happen really quickly, or taking care of like rapid changes, then probably not fields for you either. And then people who really enjoy kind of like long-term relationships with patients and want to see them in clinic over time, over years and years. My mom is someone who does that, for example. Also, this is probably not the field for you, but for me, I actually love the relationships that I get to build with patients in these really acute settings. It's an incredibly vulnerable time. It's an incredibly like impactful time, and the kind of care that you deliver really affects not only your patient, but their whole families and their experience of that hospitalization. So I really like it. I find it really fulfilling, and I love kind of the pace of it. And then I guess like what the day-to-day, which is what this question was, the day-to-day of it is, for example, like the most typical sort of model of being a hospitalist is where you are directly taking care of patients yourself. And so there's you usually go in the morning, kind of look at their charts in the electronic record and see what's going on, and then go see the patient themselves, talk to them, examine them, see if there's new issues, talk to the other team members who are taking care of that patient, so the nurse, the physical therapist, the case manager, the social worker, everyone else in the hospital who's part of that care team. And then ordering like medications, ordering new studies, talking to specialists or consultants that you have questions for, especially for things that are kind of like out of your scope as a general internist. And then also updating families and planning for the discharge or the patient transitioning home. These are all things that you're kind of doing at the same time, and balancing it all and prioritizing what's most important for each patient is kind of part of the fun of the job and also the stress of the job. And then I guess the last thing I'll say about the day in my life is that because of the nature of my job, which is at kind of like an academic center and also a really big hospital, which has like a ton of clinical services, what I just described is not necessarily what I do every day. There's a lot of other models, a lot of different other like work that we do with patients as a hospitalist that's possible because the hospital is like so big. So for example, we have sometimes I do roles in the afternoons or overnight where I'm only taking care of new patients who come into the hospital. So just seeing them for a short period of time, getting things started and passing it off to someone else. Or there are other roles where I'm helping as a consultant. So for patients who are there, for example, for a surgery, providing an internal medicine perspective to answer their questions, or working with residents and students on our teaching services, which is where they're learning and they're training, and you as the supervising doctor are helping them along and also making sure that the patient's getting the right care. And then in my time not taking care of patients, which is about almost half of my days, I do some work in clinical operations, which basically just means managing like little parts of our division. I have a small group of like 20-ish folks who like faculty in our group who report to me. So I'm involved with hiring and recruiting them and orienting and supporting them and mentoring them and all of that. And then in some of my other time, I am involved in medical education, which means teaching learners at all levels. So working with residents, I help lead our hospital medicine elective for residents and also work with medical students and like building curriculum for them and things like that. So happy to answer questions about any of that. But I think it's like a newer field. So if you haven't heard about it, it's very, very normal. And I think that the next thing I wanted to touch on just very briefly is kind of how being Armenian has played into my career path. And I guess I would characterize that as maybe like two things. The first, sorry, I live very close to the hospital. The first is probably like the importance of service and kind of like a sense of purpose for me. And then the second is like mentorship or other opportunities that have come about through like the Armenian community or network. So from the perspective of like service, for me as an Armenian, I was kind of always involved in the community. Since I was young, my family has always been involved in AGBUs since I was very, very little. I was involved in my church and Armenian school and things like that. I was part of our ASA at Stanford. I'm part of the Armenian Graduate Student Association at UCLA, and I'm still part of like the AGBU Young Professionals group. So that has always been a part of my life, and being of service to like our community has always been hugely important to me. So I think I've always wanted to be able to ultimately give back to our Armenian community through my job too. And that idea of service like aligns really well with medicine. And something that I'm like actively working on these couple of years is figuring out how exactly I can do that, how I can bring my skills, both as a hospitalist and as an educator and things like that, and in a meaningful way help our community in Armenia. So that's probably like one thing. And then the second thing is just mentorship. Like events like this are a great example. I didn't have this specifically, but I definitely had like a scholarship that I had in undergrad, an internship that I did through AGPU, and like doctors I met along the way, where just being Armenian opened up opportunities and connections with people who could really guide me and mentor me and doesn't necessarily, give you the job or get you into the medical school, but it definitely can connect you with people who can make a big difference. Okay, this is what probably y'all are interested in. So as an interviewer, so I've been involved in, I was involved in medical school and residency interviews at UCLA, and then here at UCSF too. I'm still interviewing residency applicants this year, and I also am very involved in interviewing faculty applicants, so people who are applying to hospitalist jobs this year is a big part of my job. So being an interviewer has weirdly become a big part of my job. So this is something that we were talking about with Susanna. This might be interesting to folks who are thinking about med school applications. I would say broadly that the interview is your opportunity to tell your story, to really bring together your application and to convey who you are as a person, not only who you are, but kind of what led you here and where you intend to go. And these are the kinds of things that are really hard to convey in your written application, your personal statement, no matter how beautifully written it is. This interview, this conversation is your chance to really talk to this interviewer and convince them that you're not only someone who has potential kind of broadly, but you're someone who really fits the mission and the culture of the school or the program that they represent. And the kinds of questions that you'll be asked during the interview really vary depending on kind of where you're interviewing, how holistic their interview process is, how standardized it is. But I would say there's generally two big buckets of interview questions. The first ones are the really straightforward questions where they're directly asking you about you. So they're asking you what you did, why you did it, or what's, what you learned or what are challenges. So they're really wanting to know about you directly and to pick up on things that maybe weren't addressed in the application or that they just really want to highlight. The second bucket is the harder one, which is when they're trying to find out about you through more indirect ways. And sometimes I'll be through talking about scenarios with you or questions about kind of the way that you think, or to find out what you value or how you respond. And those are sometimes trickier to respond to. I would say the best interviews that I've done with applicants kind of at all levels, I'd say all the way from undergrads who are applying to med school to career hospitalists who are applying for faculty jobs. The best interviews truly feel like conversations. And by that, I mean, you actually feel like the person you're talking to is engaged and is asking and answering questions in a genuine way. And I think what really adds to that is when an applicant has really read about the school and the program beforehand and understands it. And the kinds of questions they're asking are not things that you could just look up really easily. They're things that show that they've done their research and actually are interested and want to know more. And that there's some genuine connection between kind of where they're coming from and these questions that they're asking. And I think in terms of bad interview experiences, I was telling Sandra that I don't want to share anyone else's bad interview experience, but my own bad interview experience. When I was an undergrad interviewing for med school, I interviewed actually at UCSF for med school, didn't get in. And during my med school interview, I remember my interviewer asking me about a project that I had done, a basic science research project that I had done during the summer between high school and starting undergrad. And it had been so many years and I had no idea about the details of this project. And they were asking me something specific about the outcomes of it. And I genuinely didn't know. And I kind of made something up. And the interviewer could definitely tell that I was making it up, but kept probing and asking more questions. And then I was also kept kind of digging myself in this hole. And he knew that I didn't know what I was talking about. I knew didn't know what I was talking about, and it's just very, very awkward. And so I learned from that, and also you should generally know that you should not lie during interviews, and maybe more importantly, to not put things on your CV or not include things in your application if you're not going to feel comfortable talking about them. And I think the last maybe two things I'll say about interviews is that they can feel incredibly intimidating, but I think it's helpful to remember that if someone's interviewing you, whether it's for residency or med school or a job or anything, they've already read about you. They've already thought about you and they've selected you and they like you and you're there for a reason, and they really want to get to know you more. They wouldn't give you an interview, or they wouldn't be spending their time interviewing you if they didn't think you could potentially be a fit. So you're starting from a great spot, and it's really just about showing who you are and being like authentic to yourself during that time. And the last thing I'll say is that because interviewing is such a weird thing, and because a lot of us, especially a lot of us who are in healthcare, don't love talking about ourselves, this past half hour has been very uncomfortable talking about myself. Because we generally don't like to talk about ourselves, it is good to practice. And if you have opportunities at your school or through your pre-med groups or pre-health groups to have formal interviews, I know our med school would offer practice interviews and our residency would offer practice interviews. That's great. But even if that doesn't exist, just doing it with a friend, going through the motions of trying to answer questions about yourself, hearing how things sound on like out loud can be incredibly helpful. And even if it's not the exact same questions that get asked of you later, at least it's an opportunity to get a little bit of practice in and to feel a little more comfortable. Okay, I think that was the last thing I was going to say. Awesome.
Yeah. Oh my God, that was amazing. Okay, so now we'll open it up to Q&A. You can unmute or put any of your questions in the chat. Yeah, I'll stop sharing just so it's not just staring at a screen the entire time. Okay, now it's open to you guys. If you guys have any questions for Dr. Aline, now's the time to ask.
I have a question, Dr. Zorian. So my year will be the first year applying to residency with the new step 1 pass no pass score. And we're all just trying to figure out how residencies are gonna like select us. We keep asking, but feels like no one has any idea, and we just don't know what to do because we don't have a step 1 score anymore, which was a big thing. And now they're telling us step 2 is going to be big. And there's going to say medical schools are going to matter more, which, you know, is not fair to those who don't go to like Ivy League school maybe. So as someone who's read residency applications, like what's your take on what's going to be prioritized for residents?
That's such a good question, Pranay. I wish I had an answer, but I would be just like making it up and predicting the future if I knew. I think that by next year or the year after, we'll have a better idea. And I think a lot of residency programs are going to be trying to figure it out this year as they review the applications. I would just say, like you were alluding to, that the rest of your application is going to matter a lot more, and kind of where that emphasis is placed is not 100% clear. I think that what I've been seeing, the trend over the past few years, has been a little bit more holistic of a review of applications. And by that, I mean more attention being paid to kind of where the applicant is coming from, what challenges they've overcome, kind of how far they've come over their path, and then taking that into account in their application. And but so specifically experiences that you've had that really like set you apart from other people. And I don't mean that you need to exaggerate or make things up, because I know we all, like, there are lots of us who come from places of privilege, and there's things that are experiences that we've had, that necessarily opportunities that others may not have. But at the same time, there's also lots of things that are unique to you and things that you've done. So I would say that because a lot of that standardizing is kind of out of the picture, it's a little bit more emphasis being played on what's different in your application and what's going to help you stand out. For you, if that means specific academic achievements that are going to take the place, your academic achievements that are going to kind of like take the place of your step score to show in that same kind of like space, that's great if you have those. I think a lot of people don't have those, since there's not too many things that can compare to like a step 1 score to show kind of that same academic achievement for that same period of time. So other parts of your application may be emphasized more. So if that's research projects that you've been involved with, leadership opportunities that you've had, volunteer work that you've done, other things that you've done that are going to like boost your application and make it stand out from others. Sorry, that's not a very thorough answer.
Thank you. Yeah, I think residency programs are figuring out as well. So
yeah,
it's just hard.
It's really hard.
But thank you.
Mm-hmm.
I think Inga had her hand up, right, Inga?
Yes, thank you so much. I wanted to say thank you so much for speaking. I find these like me. I'm from the GCC APHS, so like I'm trying to like go to the other ones too and show my support. But I find these meetings really helpful, and like the fact that you dedicated your time to like you must be so busy. I just wanted to say thank you for that. But I found a few. There were just a few questions I had. I wrote down. The first one was, how did you find the time to apply to medical school during your undergrad? Because I know you said like that's not a common thing, so I was wondering how you organized yourself to do that.
That's a good question, Inga. I think I don't remember exactly what I did, but I do remember that I started early, and that I didn't apply to quite as many programs as other folks did. Specifically, didn't apply to programs that I knew were like a huge reach for me, or programs that I knew that I wouldn't be happy going to. And that for me at that time helped kind of narrow some of the work in terms of doing like the secondary applications and things like that. But still, I would still recommend applying broadly, and then starting early and then staying organized. I think that I also intentionally tried to not have as many or as hard of classes. Like I had kind of done some of my harder classes before those quarters where I would be doing the interviews or secondary applications and things like that, which definitely helped. And then I did end up having to do some like hard classes during my senior year, like at the end, which while most of my friends were having fun and not doing anything, which was okay and worth it, just because I needed to like finish up all my credits and things like that. And then the last thing was that it was really helpful to talk to like career counselors and people early, because otherwise I wouldn't have known sort of what the timeline is for these things, which I had no idea. It was kind of like on a rolling process and things like that, to know to like organize myself and give myself the best shot. All that being said, I don't know that I would recommend doing that for most people. And I don't know if I probably could have had a better application like experience, or had like more interviews or anything like that if I had had more time, and if I had been like maybe a little bit more like intentional with it. So I'd say I kind of like figured it out as I went and tried to plan as much as possible, but I don't know that it was like the best thing to do at the time, and I wouldn't necessarily recommend it unless you have the resources and like foresight to plan ahead for it.
I see, thank you. And then I for my next question, I feel like this might be, I don't know, maybe it's a bit specific, but I was wondering how you found your study methods changing from undergrad, because I know you did bio in undergrad,
Yeah.
but like how you found them changing from undergrad to medical school, like if there were any major changes there.
Yeah, that's a really good question. Actually, my study methods did change a lot in medical school. Medical school was the first time that I really studied with groups a lot, and it made a big difference. It was also the first time that my classes were pass-fail. For undergrad, we had grades for all of my classes, and for my first 2 years of med school, everything was pass-fail. There was no honors, no anything, and it made a really big difference, I think, in how people approached how people like approached what they were learning. And two, about how like collaborative everyone was. And I love that. So my close group of friends, we would have like a study group together, and we wouldn't necessarily do it like every day of like the entire block, but definitely the last couple of weeks of the block, we would kind of organize our study sessions together and decided ahead of time like which parts we were gonna cover, like who was gonna summarize and who's gonna bring snacks and what things are gonna be like for that day. And that really helped me. And I'm someone who learns well by teaching. And so I would often like read something in advance and then like prepare like a little like summary thing of it, and then like kind of practice doing it on the whiteboard with my friends. And that helped me a lot. Whereas in undergrad, I studied essentially by myself, kind of a loner, for a lot of my undergrad classes, including my like chem, OChem, like bio classes. Like none of my friends were pre-med. So I was basically just studying by myself in the library a lot of the times, and don't recommend that. So yeah, I think my study methods changed a lot in med school. And I think, I don't know how much of it is real and how much of it is a perception, but the idea that what you're learning is going to relate more directly with like actual patients you're going to take care of or your actual job does help you approach it a little differently, in like a kind of like with more purpose, I would say. And for me, that helps a lot because I'm not particularly good at memorizing things for no reason. But like when I know like this is a thing that's going to like relate to a patient I'm going to take care of, that helps me. And I think there's more and more, and whoever Patrick who's in med school now can say this, but more and more I think efforts are like shifting in med school curricula, at least like the ones that I'm involved with, to focus on like clinical reasoning and problem solving skills as opposed to just teaching facts. So for me, all of those things were big changes from undergrad learning. Great question.
I see. Thank you so much.
Yeah. I know Patrick offered to answer questions too. Patrick, do you have any advice that you want to share?
I don't know. Like besides what you said, I don't know what else to add to it, except like the practicing that you said. I really want to emphasize that. I remember my first interview, I completely bombed because I wasn't ready, and it was a school that I wanted to go to. So it sucked. But related to that, if you can, try to schedule your first interview at a school you don't really care about, like not a top priority, just as practice. But definitely practice with someone, have someone ask you questions and have your responses. And at the same time, don't type out your responses to like common questions, because then it'll sound very robotic and they'll know. But you can kind of look at questions and get an idea for what you'll talk about, if that makes sense.
Totally agree with that. I think.
I don't know if there's any other questions, but
yeah.
Oh, and then the one thing I want to say, you brought up like the whole step one being gone. What I've noticed so far in the few interviews I've had is that letters go a long way. I had like a few interviewers bring it up. Like I had good letters. And the other thing is like showing improvement if you're not a straight honor student from the beginning. But that also goes a long way. Like my step one was actually pretty bad, but my step two and my like third year clerkship scores were much better. So that's what they noticed. Like they didn't really care about step one anymore. But that was the one thing I wanted to say.
Those are both so great, Patrick. The letters are really, really important and continue to be, like when you're applying for residency and jobs too. Sorry, my cat's going a little crazy. Oh, what research internship did you do in undergrad? I don't know if this is for me or for Patrick, but I in undergrad didn't do as much research. I feel like all of my undergrad answers are basically things you shouldn't do. So you should apply broadly. You should take time before you do your applications and not rush them. You should like explore research opportunities. I didn't. Sorry, I don't know what she's doing. I did not like spend a ton of dedicated time doing research. And part of the reason was because I didn't take the time to really look at all the different options that were out there. And I didn't spend like longitudinal time with a specific research mentor. And so what I did do though was, as I mentioned, that fateful research project that I got asked about at UCSF, that one was like a basic science, like real bench work, like pipetting research in like an immunotherapy, I think, I really don't remember, during the summer between high school and freshman year of college. And then the research that I did while at Stanford was with a cardiologist doing clinical research. I like clinical research in general because it's, for me at least, it's like a little bit more clearly relates to patient care. And also you tend to get results and can work through projects a little bit more quickly than more basic science research. And so that project was like chart reviewing like patients with heart failure. And that was something that I was able to do even without like a ton of medical knowledge in undergrad. And I liked that. And but again, it was like a small project and not something that I did over years and years. And then during the internship program that I did in Armenia, I was paired with a group at the American University of Armenia, AUA, and that was actually in the School of Public Health. And they were doing some focus groups with folks and needed someone who was like more like fluent in English and could like translate some of the work. So I helped with that during my time at 808. I think those were like the main research projects that I did during undergrad. And oh yeah, whoever said this, publishing case studies is great. I didn't pick up on that as like a thing to do until med school residency, and little like cases and or like clinical vignettes or little things, definitely the way to go to get a publication if you have like an interesting case study to share. Sorry, I hope that answers that question. How did you like Stanford? I loved Stanford. I really loved it. I lived on campus for the first year, and then I commuted for like the second half of undergrad, which is unusual. Most people like live on campus the whole time, but some of my closest friends are still the people that I lived with in my freshman year dorm. What else? I like that Stanford gave me a lot of opportunities to do things that were not related to being pre-med. Like I got to study abroad. I got to take like a bunch of classes that had nothing to do with medicine that I don't know that I'll ever learn again, but I got to learn from really cool professors at the time.
We have 2 people that are raising their hands. If you guys
Yeah.
want to unmute.
Okay, I'll go. Also, first, like, thank you, as everyone said. My question, I'm gonna try to make it not me specific, but like, long story short, I'm a senior and I just decided to think about medical school and apply. And I'm a chemistry major at Berkeley, which means my classes were not. I got the classes out of the way. Long story short, my GPA is not what everyone thinks when they're applying to medical school. So the question is like, I know there's the MCAT, and the first part of the question is like, how much do they weigh against each other? Is it like I don't think it's exactly a 50-50. But if the MCAT score is there, like, how do you feel about like the GPA not being exactly there? And also, when it comes to like volunteering and working and stuff, how much do those like bolster your application? And I guess like lastly, I know you need like some sort of clinical hours or like experience before you apply. Is it okay if you're paid for that and you have separate volunteering?
Yeah, those are great questions. I wish there was like a formula to it, and unfortunately there isn't. Like there isn't like a number that things are weighted, and I'll say different schools that you apply to will think about things differently. And unfortunately, that's just like the truth of like the culture of like medical school, is that different programs have different missions, different programs have different values, and everyone I think is in the process of like rethinking how applications and admissions work. And unfortunately, like it's not standardized to that degree. It's probably for the good because there's like different people who are better fits for different schools. But I'll say there will be some schools who use things like MCATs and GPAs and things like that as like cutoffs, and like won't consider certain applications under a certain number, and other schools who don't do that at all, and who think about things like the whole picture. And I would say your MCAT and GPA, I think it's really important to think of them kind of like together, because they're together showing your kind of like what you will bring as a student, and kind of like what you have shown that you can do in terms of how well you can do with your classes in medical school. I don't know that there's like a way that like one is going to be consistently weighted compared to the other, but definitely will be thought of together, so that if you have an opportunity to, for example, make up for your like a lower MCAT score than what you would like with your GPA, that's awesome. Or if you can make up for a lower GPA than you would like with your MCAT score, that's great too. What I tell everyone who's like applying, no matter kind of like what level, is to be like honest with yourself about the parts of your application that are set and the parts of your application that are like still like within your control, that are still variable to change, and really focus your efforts on those parts, right? And like everyone has some of those. There's some things that you can't change that are just have happened already and are in the past, but there's so much that you can. And and also like the way that you frame it too in your application. So like Patrick, I think was saying, and others maybe have mentioned, like framing things as like a journey. So if something like wasn't good to start off with and then like improve, talking about how you improved it and kind of like what your goals are from here, and like acknowledging it can be like super helpful, and something that, for example, if you get to like an interview stage, is something that you can talk about and bring up. And your journey, for example, of like not necessarily knowing that you wanted to do medical school, for example, from the beginning, and then like when you came to that decision, what did you do about it and what opportunities did you seek out and all of that. In terms of having clinical experiences, I can't say this 100% because like every school is going to be a little bit different about how they think about it, but I would think of any clinical experience as being meaningful. And it's more both about consistency of like kind of like you showing up and doing it over time, and kind of what your role was there, and what you took away from it that matters more than like what kind of patient did you see, and or did you get, how many volunteer hours you had.
Thank you. It's
Yeah.
like a big, like, as you said, like it's like a big black box and we don't know what's in there.
Totally.
So
Yeah.
thank you.
Of course.
Hi, I don't have a question about application specifically, but more of like your experience in med school. So I can imagine there's like a lot that goes on in hospitals and clinics that isn't often talked about or like acknowledged, like specifically in regards to patient care and access to care. So I was wondering how much liberty you were given, or like any opportunities for you as a med student to kind of have a say for what goes on or advocate for your patients in any of that, in that realm.
Yeah. So did you mean when you're on your clinical rotations as a medical student, what opportunities do you have to like advocate for your patients, or
Right.
more broad? Okay. Yeah, it's a really good question. I think, and we have some like medical students in our group who can speak to their experiences too. I think it's when I was a medical student, it was hard to know what my role was on the team. And a lot of times I felt like a little bit of like an imposter on the team, and that I was mostly there just to like watch and learn and things like that. And it took me a bit of time to feel comfortable and to realize that in a lot of situations as the medical student on the team, you may be the one who knows the patient best, both in terms of like being most up to date with information that's happening in the hospital for them, or in the clinic if that's where you're working. And also because you're not following and not taking care of all of the patients on the team, you're really focusing on, a couple of people and getting to know them really well. And in some cases, you can get to know them as a person better than almost anyone else. And so there were like a few situations where I not only like knew the patient more than maybe like the rest of the team, but also knew some information that would kind of change our plan, or would change what I felt was like probably right for that patient. And I was completely welcome to like share that with the team. And whenever I did, it always felt like uncomfortable to bring it up, but whenever I did, it was always welcomed and appreciated. And I think a lot of that speaks to like, kind of like the culture of the program where I trained, and how they treated medical students. And it does take some like kind of like situational awareness to know like when it's best to do that, who it's best to do that with, kind of like in what situations. But I have no experience with trying to do that and being met either with like someone dismissing me, or someone being kind of like hostile to it, or feeling it was inappropriate or anything like that. And I think as more and more, like I've noticed in the medical students that I work with, that social medicine is much more kind of like closely ingrained in like the medical school curriculum, and kind of their awareness of health inequities, and then like looking out for these things and noticing them much more than maybe some of the other members of the team, including the more senior members of the team, is just like a reality. And their ability to like notice them, talk about them, and like help the team figure out what to do about them is like always welcome. So at least in the places where I've trained and worked, that's something that's not only like welcomed but encouraged. But again, I can't speak with like every team or like every hospital.
I see. Thank you.
Yeah. It's gonna need it. Yeah.
Hi. Firstly, just want to say thank you very much for the information. It's much appreciated. So my question is there anything that you could share that should be especially considered for like California medical schools specifically, in terms of like potential acceptance?
California medical school's potential acceptance. I don't know, to be honest, off the top of my head, other than what I was sharing about like you being a good fit for the program. So it's a little bit, it's not like a direct link where because you're from California or because you have contact like family in California, you're automatically more likely to get the to be accepted or to get an interview. But I do think that being from somewhere or having real connections to it, whether it's like you live there now or you have family there who you want to be close to, making that a part of your story, like during your interview, absolutely can help. And that is something that I take into account, especially when thinking about like residency interviews or job interviews or things that are going to be like for several years, medical school as well. Making that a part of kind of like your pitch of like when you're telling your story of like who you are and why you could be a good fit for this program, mentioning connections that you have to California can absolutely help. I wouldn't say that there's other like requirements for California programs that I know of as being different than other schools though.
Okay, yeah, thank you.
No worries.
I want to ask a more residency specific question.
Yeah, go for it.
Especially since you're an interviewer.
Yeah.
What are some like common red flags that you would advise to avoid?
Ooh. Red flags on the application or red flags like during an interview?
During an interview. Like what are things that people say where you're like makes you think about them?
Yes. I would probably say two things come to mind for residency interviews, which are a little bit less so for med school. Two things that are like particularly jarring for me are people who a lot of times you'll like during a residency interview, you'll be asked about like a scenario to talk about something that has to do with like a patient or like some kind of clinical case. And it's like very off-putting or jarring when people like speak in like a demeaning way about patients or in like a judgmental way about patients. A lot of times it'll happen. Not that this has happened like a ton of times, but when it has, it's when we've asked about like a challenging patient encounter or like a challenging situation that you faced like with like a team, something like that. And then people get like a little heated about it and are talking about how hard it was. But in that process, kind of are like either putting the blame on the patient or being like judgmental about the patient, things like that. And that's like very kind of like off-putting. And so I think just approaching things as like being like very patient-centered and like respectful, even when talking about challenging situations. And then the second thing, which is like a really hard thing, I think a really hard balance is figuring out how to talk about yourself and like your like career goals and kind of like what you want to do beyond medical school in a way that feels authentic to you, and having like some kind of plan that sounds reasonable and what you want to do with residency from here. And I think it's especially hard to talk about because you probably like during medical school haven't had time to think about kind of next steps, but it's always helpful to have some idea of like where are you going to go after this, or like how is residency going to fit into kind of like your career plan. And I think it doesn't have to be like a clear like 5 years from now I want to do this, or 10 years from now I'm going to do this, or I'm going to lead this, but just generally speaking, like where do you kind of see yourself, and like just to make it make sense that you want to do this kind of specialty or this kind of residency. And if people have like no thoughts on that, it can be a little hard to really like put together their picture. You're like, I know where they came from, but I don't really know what they want to do or like how we can help them get there.
I'm actually glad you brought that up. I was asked that today at an interview.
Oh yeah.
And that reminds me of a question I had. When they ask that, do they want to know, generally speaking, like your career goals or also like personal goals? I never know what to say. I kind of stick to career to be safe, but
yeah. I generally stick to career to be safe, but I'm also just like an overly private person. I don't think anyone would be upset if you shared your personal goals, but usually I think what they're asking about is career. But that's a good point. I think anything you can do to like make yourself seem more human and more like a real person is helpful during an interview. So if you can throw in a little personal that like is not controversial, that would be totally fine. Don't try to be too far
spicy.
off. Yeah.
Okay.
Yeah, this is not the time.
Thank you. That was very helpful.
Of course.
Someone asked, could you talk a little bit more about the essay portion of the application and how can we
Yeah.
stand out through the essays?
I found the essay really challenging, to be honest, because it's kind of trying to do the same job as the interview, but you're more limited. So I see the essay, like personal statement or essay, depending on kind of like which application you're talking about, as being your chance of like bringing together the different parts of your application and your CV as like a cohesive story. And if there are certain things that you haven't, that don't fit into the like the actual application, the ERAS application or the ABCUS application at an other sections, like be able to address those. It's just honestly really hard to do that in like a short, cohesive way in essay form. And so I think generally speaking, I would take it as a chance to talk about your story, like what is different about you than like every other person that they're reading, and to bring together the different like pieces of your application that you think matter the most. So for example, if you've talked about like 5 different like projects that you've been involved with, what's like kind of like the one that really like stands out that you want to highlight would be worth highlighting in the personal statement or essay portion, or a couple of different clinical experiences you've had, but like this one really stands out and is something that you want to talk more about. That's like your chance is to say like, these are the parts of the application that are most important to me, that I think you should know. And then also here are the parts about me that I didn't get to tell. Sorry, cat, very vocal. These are the parts of the application that I didn't get to tell you about anywhere else. And these are the things that are important to me, that you should know. I know that's like a lot to ask of like a very short essay, but the interview is then your opportunity to really like build on that and talk more about it if you then get the interview. But the essay is kind of like their sneak peek and their way to really like tell you apart from all the other applications they're reading.
Kind of want to add to that real quick. I think showing interest is like a big thing they want to see in that essay. Because I mean, obviously you're applying, you're interested, but I've got a lot of advice about like, show how passionate you are in your essay. It'll help with getting interviews.
And one more thing I want to add, because I interview for medical school too, is you need to have good writing skills. These essay portions aren't just showing what you've done or your experience or how passionate you are, but they also want to see your writing skills. Like when I applied to medical school, they literally had us write an essay on the spot to see how our writing skills are. So you want to make sure your syntax, sentence structure, readability is good. So if someone reads it, it sounds mature, it sounds professional, and it's well thought out and put together.
Those are such great points. And definitely, like we were saying with interviews, like to practice beforehand with your essay, your whole application, actually having eyes on it beforehand is incredibly helpful and important. Like you shouldn't be the only person who has seen your application at the time you're submitting it. Thanks, Pranny.
I had a question for Aline. If I was wondering if there were any experiences you've had as an internist that have shown you that you chose the right profession, and if so, if you could just talk about like one or like a few of those experiences, that would be interesting.
Honestly, like every week, I'm just so grateful that this is like the specialty that I picked. It's hard to think of specific cases. I think a couple that I've had actually lately have been kind of sad ones, but ones where I felt like it just felt like my presence made a big difference in these patients' lives. So I had a couple of patients actually recently who had metastatic cancers and were fairly like sick at baseline, and had recently kind of been getting worse. And in the hospital, I was able to be a part of a lot of kind of goals of care conversations with them and their family members, which, you know, doing that in the hospital is never the best, the ideal situation. Like you would always wish for that to be in a place that they have more time to think through things, that they're more comfortable and working with doctors who have known them for longer periods of time. But I think as the internist, I was able to bring a lot to that conversation and to the patients and families by giving them kind of like a more of a global picture of what's going on and what's changed and how like what the prognosis can be with all these different things kind of like playing into each other. So it felt really, it felt like kind of like a big responsibility, but also a privilege to be able to help guide them and like ease that transition for them. And I think in a lot of times you just think about like how much worse it could be, sort of if they're going through that alone or going through it with people who either didn't know or didn't care to really talk through it with them. So for me, just like thinking about the past like week, I had like 2 examples of that really stood out. And I think that happens much more often than like the kind of like Dr. Housey version of being an internist, where you kind of are coming up with like this like really weird esoteric answer to something. It's like that's very rarely the case and like almost never the case for me. The second bucket of things that are really make me feel really great about being a hospitalist are seeing patients get better quickly, which is something that is like so uncommon in medicine, especially I think in like outpatient medicine, people will work on like blood pressure management or something for like years and years and years and will like wait and wait to see results. But with hospital medicine, you'll do something and like immediately see the effect of it. So see an infection and say, or see a problem and be like, this is the medicine that I think is going to help. And you're not 100% sure, but you're like, I'm going to give this a try. And I think this is the best fit. And you do it. And then you immediately see someone, you know, breathing more comfortably or like their blood pressure improving or whatever the situation is. And that's just incredibly fulfilling to see like an immediate effect like that and to like visibly see people feeling better so quickly. So it doesn't happen always, but when it does, it feels great. And it's cool. The pace of it is really cool.
Thank you so much.
Of course.
I actually have a question. Was there any time in your journey where you felt like you were questioning it, weren't fully in it, and how did you overcome that feeling?
It's a really good question. I'd say probably during medical school, I think I mentioned this during my like 3rd year of med school, when I just started my clinical rotations, specifically my surgical rotations, my like surgery, urology. I was like waking up at like 4 a.m. and a lot of the teams, I like, didn't know what my place was and felt like I was kind of being like evaluated a lot and didn't really know what to do or say. And in those situations, it was really hard to keep going and to stay motivated. And I think in those situations, probably the 2 things that helped me were spending time and talking to my family, who's for me has always been like very grounding for me. Anytime I feel like I'm like too wrapped up in what's going on at work or like school, it's really helpful to just like take some time and talk to them to like remember what actually is most important to me and what little things don't matter. So that was really helpful. And then also, I think I mentioned my like group of medical school friends who are same people that I studied with like 1st and 2nd year, and then same people that I actually lived with 3rd and 4th year. And they were just such a source of support for me in like a kind of non-judgmental way. We're able to like commiserate because they were going through similar things and also like know me and know kind of what I'm like at baseline and know that like this is kind of like a transient situation and know kind of how much I actually love this job or like this field, and were able to help me like through those harder times. That was probably, yeah. And then I think during residency, a lot of the harder times were I think like with really bad kind of like patient outcomes, like patients dying or kind of like unexpectedly getting much worse or things like that. And it was really hard to kind of learn how to cope with that. And everybody copes differently. There's no right way to do it, but I like feel very strong. Like it's very hard for me to like separate kind of how I feel from what's going on at work. So I think those situations are really hard. And there were like definitely like days where I wanted to quit. And I'd kind of just be patient with it and give it time and have like better experiences later. But having a group of people, in that case, like residency friends to be able to talk to about it was really helpful too. They just know what you're going through and are able to relate.
Yeah, there's a question in the chat.
About a gap year. Do I have to apply during my senior year of undergrad? Yeah, what Patrick said. You should apply right before you're going to start. like the year before you're going to start. So you don't have to apply before your gap.
Okay, if there's any other last minute questions, I know we're a little over time.
Yeah.
You said you would.
I can also put, yeah, I'll put my email in the thing. I'll put my Gmail there. That's my personal email. So feel free to send me any questions. And if you sent me a direct message, I probably didn't read it yet. So feel free to email me. But I'll try to read these too.
Yes, thank you so much, Dr. Zorian, for doing this. And thank you for bringing up everybody. Yes, if you have, I know our time's out, but if you have any other questions, I'm sure she would be able to answer them. And with that, have a great rest of your day, night. Sorry, it's night. And thank you so much for joining.
Thanks, everyone. Honestly, feel free to email me anything, anytime.
Thank you so much. Bye. Thank you.
Thanks, Patrick, for your advice also. Great ads, and Prenny.
I put it out there.
Susanna, did you put this meeting together?
I did.
I have some mentees and I see like the same common mistakes from them. So I wanted to like maybe do this with some of the undergrads so I don't keep seeing the same mistakes from students, because they don't get into medical school and I read their application like, well, yeah, of course you didn't get into medical school. So I wanted to like put some together like common mistakes students make. Let everyone know. So I mean, if you guys are interested, I want to help you guys out.
Yes, I'll put in my email and then hold on, sorry. Everyone. Okay. I'll put in my email. And then I'd be more than interested to host something. Email. There you go.
Okay.
Thank you so much for joining and for your extra input.
Yeah, of course. Always here to get more people into medical school.
Of course. Email me and then I'll reply really soon.
All right. Thanks, guys. Thank you,
Bye.
Dr. Zorian.
Bye.
Susanna, I had a really quick question. So I joined late because I was working and I noticed it's recording. Do you know when it would or if it would be posted anywhere?
Yes, it's gonna be posted on the YouTube channel. The YouTube is just Armenian Pre-Health. And there's other webinars in there as well. This will be up. I'm gonna email it to the person that takes care of the YouTube channel right after this meeting. So probably be up in like a day or two.
Okay, perfect. Thank you so much.
Thank you for coming.
All right. Susanna, thank you again. You're amazing.
Thank you so much for joining. This was more than everything. And I'm sure people were very satisfied because I was very satisfied. So
good. I'm glad that we had some medical students in the group too. That was good.
I know that was very surprising. I did not expect that. I was like, they're like third year, and I was like, whoa. But
good.
Yeah.
Cool.
Yes, I will. We will post this if you want to go look back at it, show people. But thank you so much.
Yeah, of course. My pleasure. This is great.
Yes.
Email me anytime if there's anything I can do to help.
Yes.
Also,
Also,
what else you guys are up to?
yeah. Also, I was wondering to do like a consulting event maybe next semester with like a whole bunch of doctors, and I would probably collab with the frat here, a pre-med frat, make it like a big thing. So if you'd be interested in doing that as well, but that'd probably be like next year. Yeah.
Okay. Let me know.
So much. Have a good night.
All right. Have a good night. Bye.
Bye.